Could you walk us through how easy it is for a first time user to set up and use Tracky CGM?
So this is my most favorite question. So basically Tracky CGM has two components. One is we call it the transmitter. Transmitter comes with a transmitter rechargeable case. And this is the transmitter that you can see. It's a Tracky CGM transmitter. The second component is the sensor and applicator. So sensor is placed on the bottom of the applicator. What we need to do is to really charge the transmitter. It takes around anywhere from 10 minutes to 30 minutes to charge the transmitter. Once the transmitter is charged, you take it out like this and open the mobile phone, launch Tracky CGM app. Once you connect the device, you'll find one of your transmitter started showing there. Once you select it, your transmitter get connected. Very simple process, hardly takes any minute. Then you have to just open the sensor pack, unlock the sensor applicator. This is the orange button. Take the sensor to the wherever you want to place, and using this gray button, you have to just press it. Once you press, the sensor will be placed. Once sensor is placed, just ensure that it is being placed right, and you have to take the transmitter and put it on the top of it. It's just one click exercise, and once transmitter is placed, it would take 1 hour to warm up, and after 1 hour, you start getting data on your mobile phone. In our back office, because the data monitoring is being real time, we'll get to know whether your data is correct or not. And if there is any issue, our back office team will call you back and help you to resolve any issues.
In your view, what key challenges do diabetics face in glucose monitoring today, and how does Tracky address these gaps?
So basically, the biggest challenge if you see in diabetes management worldwide is frequent, pricking off your fingers to draw blood and doing testing using a traditional blood glucose monitor device. This pricking, not only create inconvenience as you have to do it many times in a day, but also it creates a huge amount of anxiety. And when you are doing these kind of pricking reading, you don't get a overall understanding about how glucose is changing with your daily routine. Even the monitor that we have, the CGM monitor, those are available in the market, were largely flash monitors. So unless you scan, it's very hard for you to understand the glucose trend. And if you forget to scan, then you may not know what has happened and what is happening in your glucose reading. With Tracky, we try to kind of basically address these gaps in the market and these gaps in the way glucose monitoring being done by diabetic patients. So the Tracky brings you a very simple, easier, simpler way of managing glucose. It's a Bluetooth enabled. It's one of the only product available in the market which gives you real-time glucose reading. You may not need to prick or scan like flash monitor. Tracky also offers you an opportunity to record your meals, your activities, and also assess your overall trend. In a way, it gives you an opportunity to analyze and then make optimal changes to enhance overall glucose control.
What makes Tracky's Bluetooth-enabled CGM system stand out compared to traditional solutions like Libre 1 or Libre 2?
So basically, product from Abbott portfolio like Libre 1, Libre 2 are largely flash monitor. I think Libre 2 still would require you to do NFC activation. So if you don't have NFC phone, there will always be a challenge to use a product like that. And also most of these products, those are coming from the larger global players, are designed for global usage, and they comes with standard features. What we bring and differentiating actually within Tracky CGM ecosystem is a product and an ecosystem designed for India by Indian. What that means is, first of all, the entire app experience has been designed looking to Indian, daily routines, Indian cultural viewpoints, as well as the way, Indian lives their life with diabetes. The entire food tracking has been designed for Indian food palette and food menu. So here you get a very large comprehensive database of all majority of the food item that we consume on a daily routine. And it's very easy for you to capture your eating habits, your eating routines, your glucose data, as well as your activities. And a combination of that you see in your report, and leading that to you can share with your physician, your doctor, you can analyze yourself and can help you to really understand how glucose basically trends is impacted by your lifestyle. This is one and the only system that has been designed for India by an Indian company.
How does Tracky balance cutting edge features with affordability, and how are you working to make it accessible to all socioeconomic segments?
So basically, if you see current range of CGM, these are use and throw devices. They are one-time usage and leading to very high cost of product. The innovation that we got it is where we have basically created two component system. There is a transmitter that can work for 5 years, and there is a sensor that works for 14 days. By making transmitter reusable for 5 years, we are able to bring down the cost by 25%. And what we are aiming to do is to really see how we can slowly reduce the cost to less than 1,000 rupees. It might take 2 to 3 years time, but once we reach to that 1,000 rupees benchmark, we believe that almost the entire 110 million people with diabetes would go for a product like Tracky CGM.
Do you have any patient success stories or feedback that highlight Tracky's important impact on users' health journey?
So we have, though it's only short time, it's just 4 months in our journey, but we have quite a few success stories, very impactful stories actually that we got to know from our customers. Typically, story involves where a senior leader from industry basically started using CGM. This was his first time because all other time whenever he tried with limitation around NFC and his very convenience around flash monitoring, he wouldn't like the product. But this time when you use Tracky, where the alerts and monitoring is continuous, he could able to understand the trends and impact of his lifestyle on glucose. With our app, he was able to record all the food and the impact of the food intake and the activities on a glucose spike. Combination of that 14 days of study, he could understand that how he can really optimize the number of spike and remain target in range that is supposed to be 80% plus. He shared this story to us and said that this is the first time in his 15 years of living with diabetes he could able to manage his diabetes, his glucose spikes effectively. Likewise, there are many other examples. There are example where an elderly person who has been struggling with glucose monitoring was not able to really use any kind of glucose monitoring system because of very high glucose, uncontrolled diabetes in a way. And pricking was not possible because very painful for an elderly person. When he adopted Tracky CGM, he realized that a small improvement in his daily routine can help him in optimizing overall glucose spike and then leading to multiple changes in his treatment journey.
How does Tracky support healthcare professionals and family caregivers in delivering better diabetes care?
So Tracky is India's first and probably one of the very few in the world ecosystem where we have a dedicated interpretation lab. An interpretation lab is being designed to offer real-time patient monitoring capability for caregivers and doctors, and also coaches if they are involved in the overall process. The caregiving interpretation lab capability offers you not only the insight about glucose profile trending, spiking, but also helps you to know the outcome of activities, whether it is related to the sleep, daily exercise routine, or food intake. In a way, you get a full picture of how a patient is living with his diabetic condition and what interventions are required to really alter his overall diabetic profile. So that's a one part of this. Our ecosystem is consist of basically three different components. There's a patient-centric app designed for self-management. There's caregiver app, which is basically where patient can share real-time data to the coach or a caregiver. And then there's an interpretation lab, which is being designed for doctors so that they can have deeper understanding about profile, and then basis on 14 days and long-term analysis of glucose trending and medication effect, they can decide what kind of medication protocol can be followed.
So what's next for Tracky CGM?
So basically, our vision has three components, or you can say three parts. The part number one, the most important for us, is to really bring affordability to CGM. Our objective is to really reduce CGM cost to less than 1,000 rupees within the next 24 months time. Make CGM available to every one of the Indian who is struggling with diabetes and make their diabetes journey easier, little less painful, and also cost effective. The second part of our vision is to see how we can build an app ecosystem where we are not only offering the glucose data, glucose profile, but combining glucose trend along with other vitals, which we can measure through wearables and other devices, and creating an integrated view of a person's health. Also helping with using our AI coaching capabilities, we want to also help him in real time to see how he can take very small baby steps or small daily routine changes to keep optimizing glucose spike, in a way helping him to really remain within target range of more than 80%. And the third part of our vision is to see how we can empower doctors and caregivers. Our whole objective is to see how we can create our interpretation lab capabilities to the level where CGM data as well as the vital data can help doctor to understand the impact of medication and can take appropriate titration decisions. Meaning that if a patient is on a particular medication, based on our report, a doctor can assess whether this medication is effective or there is a need for some changes. We are building this ecosystem, the overall therapeutics, in a manner that it covers almost all aspects of diabetes management and almost all stakeholders.
As we at Startup Success Stories always love to ask, what advice would you share with aspiring health tech entrepreneurs in India?
So I think my journey this August we are completing 10 years in Dr. Store. It took us like first 5 years was a discovery phase. We spent a lot of time going and meeting doctors, healthcare practitioners, going meeting patients, trying to understand what are the major gaps in Indian healthcare ecosystem while we were knowing from day one what we wanted to do and where we want to go. The last 5 years have been building an ecosystem step by step, part by part. It's a tough, tedious journey, though there were so many things happening in parallel. I think what matters here is that have you got hold on a real world problem? Are you really working on it? These problems are not easier to solve. What we need to see how we can build a long-term view and take a problem and try to solve step by step. The other thing is that while funding is important, investment is a need to build a larger, great organization, but I think more important is to build a strong team, a capable team that is complementing your vision. I think today, if one thing that I'm proud of, that in Dr. Store, in Tracky, we have one of the best team in industry. We collectively building an organization that will have a larger impact on not only in Indian healthcare ecosystem, but globally in a matter of next 4 to 5 years time. So the question is, what prompted us to really design and launch a product like Tracky CGM? And the story behind is, we've been working in CGM segment for past few years. If you look around, then you may realize that most of the products are available in the market are not truly designed for Indian market. And the technology that has been used, largely NFC, which is near field communication, is not a commonly used protocol in our country. Now, this technological limitation as well as very high cost of these products, because those are largely designed for a Western world, leading to very limited adoption of the product. While we are a country world largest population of diabetic patients, around 110 million diabetic patients, every one of them needs CGM. So when we were looking around the segment and we thought, okay, let us come out with a product that is revolutionary, that is affordable, and comes with a technology that is more common in Indian market. And hence, what you see here is Tracky CGM, India's first Bluetooth-enabled continuous glucose monitoring system. It transmits data continuously and it uses a Bluetooth protocol that is commonly used even at a low-cost mobile phone in India. The product is the most affordable CGM ever launched anywhere in the world.